Hello, assalamu alaikum, good morning, khushamdi, ji ayanu, goeiemorgen.
Pakhairagele, ni hao, tunashumme, washmale, ohio gozaimas, guten morgen, hola, boyor, privyet, kaifa hal, hale shuma chatore, ahlan wasalan, marhaba, buna, mucho, gracias, suavia, vallikaraya. And thank you very much, ladies and gentlemen, for tuning into PTV World. You watching World this morning alongside the very fantastic, the very energetic, the very amazing, the very superb Shiza Hashmi and Shahzad Khan. Hello, Shiza, how are you doing today?
I'm doing absolutely great. Thank you so much for asking. And I think I'm doing better than the usual mornings for a very minor thing, because of a very minor thing, actually.
Would you mind if I guess the reason?
Okay.
It might be because you've had your morning cup of coffee.
Well, yes, that is, of course, a fact. But other than that, just on my way to work today, I realized how just a small act such as a smile can be such a mood booster for someone,
Yeah.
right? I mean, of course, smile is contagious. It is the easiest thing to pass on to someone. It is, well, a sadqa jariya, and then it's a sunnah as well. So why don't
Exactly.
we all start our mornings, every morning, in fact, with smile? Doesn't it happen, Shazad, when you're looking at someone who's smiling, probably, well, thinking about something, using their phone, or just in general smiling, since it's contagious, you start smiling, right?
Yes, exactly, and you're very right as well. And thank you very much for starting the show on such a smiley note as well. And ladies and gentlemen, I always say this: the smile is the best curve on a human body as well. And I think that there's this very, it's a coincidence. And ladies and gentlemen, this happened with me today as well.
Okay.
So that guard who actually opens up the barrier for me every
Yeah.
single day smiles whenever I'm entering. And
He's so
today was
sweet.
the first day when I actually rolled down my window. I was like, your smile is amazing. And I think that for the next couple of days, he'll actually be smiling whenever he's going to open that barrier for me. And I want him to open that barrier for me as well. So compliments, ladies and gentlemen, do make other people's actually day wonderful as well. And I think everybody
Absolutely.
needs to do that, which is why I've got this new habit. I don't know whether you've picked up on it or not, but every day, once we are stepping out of our makeup room, I say it out loud as well. I want everybody to have a great day as well, and make sure that I say it with energy, and everybody kind of feels it as well. So if you radiate energy, ladies and gentlemen,
Yes.
everybody's going to absorb it and then radiate it on their own wavelength. So please make sure to start your day early on with a very positive message or a positive thought, and be thankful to Allah Almighty for all He has bestowed upon all of us.
Absolutely, that is actually something brilliant to, I think, start our day with as well. We really hope that you have an amazing day ahead in terms of work, in terms of, well, staying home mostly, because I hope you do. And, well, talking about the pandemic, Shazad, we always do, and we will keep doing that until and unless, of course, this thing is gone. We really hope it's gone soon. But here's the thing, thousands and thousands of new cases do come in almost every day in Pakistan now. Unfortunately, the number of the cases has increased threefold as compared to just September, which was what, 2 months ago. Do we really want to go back there? I really hope not. So please, please be careful. Do not forget to wear your masks. And for all the people who feel suffocated, or for all the people who think masks are not going to make a difference, you need to read about it. I think if you don't want to take care for yourself, please wear them for the people around you, right? We have to be that careful right
Exactly,
now.
and me and Shiza, we might have forgotten upon this contract which we made amongst ourselves as well, and that was that every day we are going to share a single tip of for all of those people who might be looking
sorry.
after their loved ones as well, who are actually going through COVID, ladies and gentlemen.
Yeah,
So
so do
there's
you
this
have one
one
today?
tip which I wanted to give away to people as well, and that is that I've seen people traveling in cars by themselves and wearing masks. Hey, you know what? You really do not have to wear a mask when you're all by yourself or in your car as well. You're just suffocating yourself, or it might get claustrophobic for you too as well. So there's no need to do that. And it came up to my mind because just yesterday I was actually going to the drive-through so that my daughter can actually get a burger, which is not, again, very healthy as well, but once a month is fine. So she was wearing a mask, and she said that, Abba, why aren't you wearing a mask? I was like, Putter, we've been together ever since, and we were just playing in the house, and we're together. So I don't think that we are actually dangerous for each other as well. So you can take off your mask. But she did, because I think her mother told her not to actually take off a mask as well.
That's
But please,
nice.
ladies and gentlemen, if you're all by yourself, or if you're the same people from the same household who've been living together or who've been together lately, I don't think that you really need to carry masks amongst each other until and unless you have symptoms, because God forbid, if you have symptoms, that's the time when any other person can actually get the virus from you as well. So just look after yourselves and don't wear a mask when you're all by yourself. Yeah, that's
Right,
unnecessary.
absolutely. Yeah, I mean, it's not harming anyone, that's okay, but just this was sort of, for you to understand better that it's not absolutely
I mean, just
necessary
imagine,
to.
you know, you're driving a car, you're all by yourself, and you're wearing a mask. I mean, who are you protecting yourself from? The car?
What
Don't do
if they
that.
open the window and probably give something to the beggar or something? I don't know, I'm just speculating over here. But here's the
Yeah,
thing, Shazad.
that's a
One
good
more
point,
thing,
though.
right? So, one more thing. Elevators, especially in the pandemic. Oh my God, it's a chaos, right? So we're either using our elbows or either using our feet to do that. And in case if it's touch, yeah, of course, man.
Yeah.
Like,
I think you could use your finger. I mean, just do it like
yeah,
this.
but it's gross. It's just gross. Just thinking about it, it's really gross. But I was thinking, of course, pandemic is one thing that just started this year, right? So I really hope this makes us improve our habits of having a healthier lifestyle. So, for example, I live on the 5th floor. It's really convenient for me to actually walk down the stairs. To be honest, it is very convenient for me.
Walk down.
Walk
What
down
about walking up?
That's the hard part. But here's the thing, we're always looking for shortcuts, right? And it is because of this as well, because of the sedentary lifestyle that a lot of people have.
I know
over
where
here.
you're going, but I have a very amazing thing to add over here, and that is for all of those people who might actually, you know, take it very seriously as well. And ladies and gentlemen, if you want to lose weight, I think that you need to take it seriously.
Yeah.
That for every step you take, you know, when you're going up the stairs, you're actually burning 0.6 calories on every step. So you can probably burn a lot of calories. How many steps do you have? For
I've
example,
never
if you have to
counted.
make it to your 5th floor, how many?
I don't know.
So with 2, if you make it 10, you know, ladies and gentlemen, just imagine that you might be burning calories. And then, you know, you stay fit. Since she's talking about sedentary lifestyle, yes, we all know that we're very habitual of even going out somewhere and we want a chotu to come and, you know, get us all the stuff as well. I think that we really need to get rid of it. We all need to be physically very fit.
Right, absolutely. And Shazad, you know what? Just by doing that, just by, well, having a practical or, you know, a different lifestyle than we already do, or just by probably having activities to do like walking or working out maybe, or not eating unnecessary stuff, we can reduce the risk of getting diabetes by 58%.
Wow.
How huge is that? And while just listening to it might sound generic, but you know what, Shazad, actually millions of people in Pakistan do have diabetes, right?
Exactly.
And this is not only adults, these are children as well, unfortunately so.
But I think it's our family system which is at fault. Imagine you have younger brothers and sisters, you need a glass of water, chote yaar, pani do la do. Ammi, I need this. So, you know, your mom will get you that as well. So obviously, the mothers obviously are fit just because of the fact that they're doing all the chores every single day as well. But ladies and gentlemen, I think Shiza has a point over here that we really need to look into the kind of lifestyle we have. And, you know, as the day passed, you know, we're becoming more sedentary as well. With all of these delivery systems in place now, nobody wants to go out of their houses. So we're not really even working out. We're not exercising. We're having all the junk food because we get it delivered. And so we're literally not looking after ourselves as well. Since it's going to be World Diabetes Day tomorrow, ladies and gentlemen, so we wanted to dedicate this entire program to diabetes because over here in Pakistan, more than 19 million people suffer from this disease.
Yes, and if we don't, you know, take charge of it right now, experts say that by 2030, 26.2 million Pakistanis will be diabetic. And that is not nice because imagine 64% of us are already young. So if the youth of the country are going to be diabetic, I don't know how we're going to take charge of things that need to make a change as well.
Yes.
So
and just in my household, Shiza, you know, you'll be very surprised as well that, you know, one of my nephews who's actually 7 years old, we figured out that even he's got diabetes. You know, there are different types of diabetes. We're going to talk about that. And we have people who have certain particular areas who they're going to talk about. We even have somebody who's actually going to let us know that, God forbid, you know, because in diabetes, you know, you really do not feel whether you've hit your foot somewhere or if you've got yourself injured, and later on, you know, there's a lot of difficulty recovering that particular part of your body.
Okay.
So we'll be talking about that in detail, ladies and gentlemen, but we have a small report we want to share with you. Go ahead, take a look, and when you guys will come back, we will dedicate ourselves to be in conversation about diabetes so that we can raise as much awareness as we can, or whatever is in our capacity. We'll put it in front of you on the table. Let's take a look at this report. Good morning.
Diabetes today has become one of the leading fatal illnesses around the world. Within Pakistan, more than 25% of Pakistanis are suffering with this life-threatening illness. One of the leading reasons behind the rapid increase in diabetes within the country is inadequate knowledge and the ignorant behavior of citizens. For the very first time in Pakistan, making treatments accessible and convenient within major cities like Islamabad and Lahore. The Diabetes Center has opened doors to medical treatment in accordance with international standards, and the state-of-the-art facility offers treatment of all diabetes-related illnesses and problems under one roof. Currently, the Diabetes Center has 7 successful clinics operating at full capacity. These include the Kidney Care Clinic, the Foot Care Clinic, the Eye Clinic, Children's Type 1 Diabetes Clinic, and Women and Male Specialty Clinics respectively. The Diabetes Center is home to one of the country's most innovative and technologically advanced laboratory, followed by a well-established pharmacy that offers a wide array of internationally approved and recognized medications. It is important to highlight that all of these services offered are with a not-for-profit ambition, and those in need and the underprivileged are treated absolutely free of cost. Those who are unable to afford treatments are subject to avail beneficial discounts. The Diabetes Center is not only the country's largest diabetes hospital, but is the only institute where 70% of diabetic patients are treated free of cost. The Diabetes Center remains a dream that is incomplete without your contributions and donations. Your support increases our will and courage, and the gift of donations from you have been, are, and will continue to be the pioneers of our success. The daily operational timings are from 8 a.m. till 4 p.m. In addition, both Islamabad and Lahore clinics are now offering consultation in the evening from 4 p.m. till 7 p.m.
All right, ladies and gentlemen, so that was a small report so that each and every one of you can have a better understanding of what we're going to talk about today. Ladies and gentlemen, the World Diabetes Day is going to be tomorrow, but since we do not have a show on Saturdays, ladies and gentlemen, we wanted to dedicate our day today to World Diabetes as well, because there are a lot of people living with this condition. What is it? Why do we get it in the first place? Why is it so prevalent within our country and this part of the region? And then how do we actually adopt to a lifestyle where we can actually control it in a way that it is no more a hindrance in our life, ladies and gentlemen.
Right.
To talk about this, we're very lucky that we've actually been joined by a consultant diabetologist. I like the name, diabetologist.
Right.
He is
Interesting.
Dr. Nuzhat Hamid. Hello, ma'am. Assalamu alaikum. Good morning.
Thank you very much for having me on your show.
Thank
our
you very
pleasure,
much for
ma'am.
joining us. It's wonderful to have you. And alongside Dr. Nuzhat, ladies and gentlemen, as we said, that we actually have people who will talk about the nitty-gritty of the disease itself as well. So we're very lucky that we've actually been joined by a diabetic foot specialist as well. He is Mr. Kamran Salim Awan. Hello, assalamu alaikum. Good morning, Doctor.
Walaikum salam. Thank
How
you
are
very
you?
much for having me. I'm fine.
Thank you very much for joining us. Wonderful to have you. So let's get the conversation started.
Yeah.
It is an important day tomorrow. We want to talk about it. Diabetes itself, what is it? How many types are there? Let's start from the basics.
All right, okay. So basically, let's talk about what diabetes is.
Yeah.
It's an elevated blood sugar level, either due to an absence of insulin or when our insulin doesn't work as well. Right? Two main types of diabetes. There are multiple smaller types, but the two main ones that we all know about is type 2, which is the commoner one, where our body isn't receptive to insulin, so we have raised blood sugar levels. Now, those raised blood sugar levels that are in our body, they damage our cells and our tissues.
Okay.
And with the passage of time, we suffer several complications as a result of those. So complications like these raised blood sugar levels can affect the small blood vessels, so they affect our vision, they affect our heart, they affect the nerves and damage our feet, and we get ulcerations, and that results into leg amputation and all of that.
All right.
Right. Type 1 diabetes is something that happens in children.
Okay.
That's sudden, and it's due to autoimmune destruction of the pancreas. So that we have no control over that. And thankfully, that's the least common of the diabetes.
And
But
should
there is a
that always
sizable-
be a genetic?
It's generally, you can't say, it can be genetic,
Okay.
but generally we don't actually understand what happens.
Yeah.
Like why it happens to a certain child, why it doesn't happen to another child.
Okay.
And there's no way that we know about preventing it. But it's the way that it acts is the same, because it happens in a younger person and there's complete absence of insulin. Insulin has to be provided from the outside, which is via
Right.
an injection.
Right.
Yeah.
And it is a scary thing to happen to a child. It's sudden. There's great, huge raised levels of blood sugar, and there's frequent urination, increased amounts of thirst, there's dramatic weight loss, and the child can get sick very, very quickly.
Oh.
Now, type 2 is more gradual. So most of the time we miss type 2. We miss the diagnosis of type 2, and sometimes we might even have it and not know about it, which is why in Pakistan, as with the rest of the world, half of the people don't even know they have it, or they're bordering on diabetes, which is why this public health campaign is so important. This is why World Diabetes Day is so important, so we should be self-aware.
Absolutely.
And the third type that I'd like to touch on is gestational diabetes, which is diabetes in pregnancy. This is also an underdiagnosed area, because lots of our women will go through diabetes without even having a single finger prick check.
Okay.
And it has huge complications on the child and on the mother. So I would recommend, or I would advise, actually, it's not my recommendation, it's international recommendations and guidelines. We as a nation, Pakistanis, we are susceptible ethnically to diabetes. There's a lot of diabetes in us as a nation, and our women should get a test for diabetes at the very least.
Definitely.
Because in pregnancy, there's no symptoms. You don't feel any symptoms of diabetes as you do normally.
Okay.
So, and you're gaining on the weight because of the baby. So your tolerance goes down. So which is why it's advisable all pregnant women should go through this test.
So
and
are
it's a
you
simple test. Yeah.
Sorry. So are you saying that there are chances that after getting pregnant, the woman may develop diabetes?
Absolutely, absolutely. And once the babies deliver, and most of the time it resolves. That's what gestational diabetes is by definition. But these women are susceptible to developing type 2 diabetes later on if they're not careful with their diet and with their weights. But it's that actual time of pregnancy where it can very easily be missed. And then you have big babies, then you have birth defects, well, not defects, but birth problems. So it's something to look out for. And I feel it's under-recognized and underdiagnosed.
Absolutely. But Dr. Nusrat, you know, this is something I actually wanted to talk about in the later half of the show, but let's do it already since we're speaking about it. So this is actually a question from someone who's been on the show before. She happens to be diabetic, and she's now she's pregnant now, mashallah. So should we be expecting any complications, other than the usual ones?
Because having diabetes before getting pregnant as well.
Type 2 diabetes before pregnancy.
Yes.
Their diabetes progresses. Like their blood sugar levels will raise, will get higher than their normal levels. And the other thing is, there are certain medications that you're not supposed to take in pregnancy, so you're supposed to be only on insulin. So sometimes it becomes challenging to meet the daily requirement, to match the daily requirement and to match the insulin doses. But you have to be very, very careful with insulin doses and with your blood sugar levels. As long as the blood sugar levels are monitored regularly, there's no complications. As long as the sugar control is good, there's no complications. And you have a normal sized baby. But what happens in gestation is more so the women don't know. So they're not careful. So hence the complications.
All right, so talking about that, I think obviously we want to know the causes as well, but very quickly, just in the introduction, you were saying that there are people who are actually bordering on diabetes. What do we mean by that?
We'll call them pre-diabetes, and this is a very huge part of the population. Pre-diabetes means that you've not yet crossed the threshold for being diabetic, but you're bordering on it. And if you're not careful with your diet and exercise, it's because of excessive weight gain and the sedentary lifestyle that you're talking about. If you're not careful, then if you let things go as they are, then you can develop full-blown diabetes. And it's this group of people that we want to work with the most, because we can prevent it. We can prevent that diabetes from happening. And diabetes has a huge cost implications, not only for the individual and the family, but for the country as a whole. So if we can prevent this, we can prevent a lot of cost, a huge amount of cost and disability.
So let's talk about this in the first place as well, for people who are bordering on diabetes as well, because I've come across this situation. I've seen a few elderly members in my family, they check their sugar every day. It's somewhat around close to being high as well. And then they're like, what, it's fine. So if we can prevent it, how can we prevent it? All right.
Now, if you're talking about the elderly population, sometimes we see that they tend to go towards the diabetic range. You just look at the general health. The general health is good. We can give them a little bit of flexibility, because age-related is something a little bit different. If they're overweight, we have to see to that. If they're sedentary, we'll have to try and change that, try to get them to exercise. The fasting sugar levels, if you're talking about facts and figures, our sugar levels should be below 100 to be normal, and above 126 to be in the diabetic range. So the group of people, the fasting blood sugar, the group of people where the blood sugar is from 100 to 126 is the pre-diabetes lot. Right? So if the elderly population or the young population, if they're bordering on that, then they should try and lose weight and be a little bit more active.
Okay.
So how would they lose weight is to avoid the sugars and the sugary drinks and the empty calories and exercise a little bit more.
Well, I wish that was as easy as it is to say as well. But moving on to Mr. Kamran over here, so when we were reading about the theme for this year, it happens to be the nurse and diabetes. So we are celebrating the nurses all over the world, recognizing their role, of course, in the health sector. But to explain it better, how would you do that? Is that even relevant to the context of Pakistan and diabetes?
It is definitely very relevant. It's because if you see just the sheer number of nurses in the country, they will definitely outstrip the doctors on the ground right now. So definitely there are larger number of contacts with the involved population that is possible if our nurses are well trained and they do all the training for our patients involved, and of course the population in general, because then if our population is well educated, then it's not going to contract the disease. And it's going to make those lifestyle changes that are required.
Right, absolutely.
All right, and speaking about that, I think what we need to do right now at this point of time is that we talk about the causes for type 1 and type 2 as well. So there are only two types, right?
The main two types.
Yeah, the main two types.
Yeah.
So type 1, we as you just said, that it's very common amongst kids as well,
Yes.
and that too at very young age as well. So let's talk about the age category and the age framework. For example,
Right.
3 months to I don't know till
So
where
generally
can I?
puberty.
Early teens?
Generally puberty.
Okay.
All right. So let's talk about that. What are the causes for that? Is it all genetic or?
Yes, yes. For type 1, you generally don't talk a lot about type 1 because it's not the preventable one. It's not the one that we can do anything about.
Okay.
Medical science hasn't come up with a formula how to avoid that autoimmune destruction of the pancreas.
Okay.
So it's generally not talked about too much, and it's the least common of the two diabetes. 5 to 10% of the population is type 1, which is a sizable, it's a sizable proportion, but you really can't do much about it. It can hit anybody in any family, and it's very, very random.
All right.
But what's important to recognize about it is what to expect.
Yeah.
Parents and family, what should they expect? If a child is drinking huge amounts of water, excessive amounts of water, this is buckets and bucket loads, and peeing huge amounts. Some children even start bedwetting, or they can't control their bladder because there's so much water going through because of the osmotic symptoms. Or if the child is excessively hungry because food isn't getting, energy isn't getting where it should get to because there's no insulin.
Right.
And they start to lose weight, they start to get acidotic, they start to get very sick, that they, God forbid, end up in ICU until they get that insulin.
Yeah.
So it is very dramatic. You can't miss it. So if you see anybody, or if you, it takes, could take a couple of weeks to a couple of days, depending on how much destruction is going on.
But Dr. Nusrat, you know what, all the sort of symptoms, I don't know, let's say,
Yes.
you mentioned, if they do occur in a child, diabetes is not the first thing that comes to a parent's mind.
Yeah.
It
Yeah.
probably never even does, unless and until,
Yeah.
you do get tested and the doctor tells you, okay, your child has this. So first of all, this is why we're here, sort
Yeah,
of raising
absolutely.
awareness, because it is so prevalent over here and so common. You might think, okay, I don't have a family history, it's never going to happen to me.
Yeah.
It may not because of a family history, but because of your choice, your lifestyle choices
Exactly.
as well. But Mr. Kamran, and we're going through a pandemic, unfortunately so. And it's been hard for so many people because this is not the only thing that is existing, right? People have pre-lying medical conditions as well. So talking specifically about people with diabetes, if they do contract the virus, is it going to be hard for them to, live with it? What are the complications that they may be expecting?
Which virus are we talking about? here?
Coronavirus.
Coronavirus.
COVID-19, yes.
All right. I think Ma'am Nusrat would be in a better position to talk about it, but I think
Okay.
what I would like to add
Yes.
to the point that Ma'am Nusrat was making,
Yeah.
the sentence that we have to remember is the genetics loads the gun and the environment pulls the trigger
Oh, so important.
in diabetes.
Yes.
So we cannot really count out the genetic factors.
But
If you have
the-
genetic predisposition, so we have to keep this thing in mind that the genetics is going to load the gun for you,
Right.
and the
right.
environment is going to pull the trigger. So you've got to
Exactly.
take care of your diet, your exercise, all the things, and only by combining these two things are you going to create a homeostasis
That's
in your
right.
body. So I'll just
Yeah, for the,
Okay.
for the virus, like your question for, it's a new virus, and we were learning as we went along.
Yeah.
For diabetic patients, as far as our diabetic patients are concerned, any infection that touches a person with diabetes brings their blood sugars up,
Yep.
and they are more susceptible to be sick than the rest of the population,
Yep.
which is why it was very important from the beginning that we emphasized and we stressed, all the healthcare facilities emphasized that diabetics shouldn't routinely go to the hospital. Nobody should go routinely to the hospital and expose themselves,
Okay.
because they will be a lot sicker than the general population. So this is the main thing. The main thing for diabetic patients is just to avoid. Of course, nobody wants the infection, but
Yeah.
if they contract it, they will be a lot sicker than
normal.
Than
than
anybody
normal.
else.
Yeah, than
Because
everybody else.
their immunity is compromised.
is down. Yeah, it's
Exactly.
compromised.
And adding on, I obviously know that you have a
Yeah.
question over here as well, but let's
No
just
problem.
ask about the causes for type 2 diabetes,
Yes.
which you
Yes.
said is preventable as well.
Absolutely, absolutely. See, we're seeing a lot of type 2 diabetes, and we're seeing type 2 diabetes even in children.
Yeah.
This is the preventable type. This is the one that we really need to focus on.
Okay.
And it's happening because, A, we are an ethnically susceptible population. Us
Right.
Pakistanis, Bangladeshis, Indians, we're a susceptible population.
Okay.
Okay, we can't do anything about that.
Is it because of pie, nihari, and all of the
That comes
food you
afterwards.
take?
That comes afterwards.
Yeah.
We can't do anything about that. We can't do anything about our family history. If somebody has diabetes in our family, we can't do anything about that.
Right.
But what we can do is not gain weight.
Yeah.
Okay, we have to really seriously address these issues, because there's no good talking about it. I do this in clinic every day, explain to my patients, it's not easy for anybody to change their lifestyle. If somebody was to tell me I have to change my habits, it's going to take time. But all I say to my patients is one step at a time.
Okay.
Like you recognize, you live on the 5th floor, you use the stairs to go down, which is excellent, and maybe you'll build up the courage to start to take a couple of
Come up as
flights up as well.
Well, I hope so.
It's small changes. It's small
Yeah,
changes, isn't it? We can't take a complete U-turn. We're creatures of habit. It takes time.
Right.
But whatever we do, it should be a step in the right direction, and we need regular counseling and motivation for that. So when you go to a diabetes center, which is dedicated specifically for this, because looking after diabetes is not just a prescription. It's not writing medicines. You can write the most expensive medicines on the earth, but it's no good, because who wants to take so many pills without knowing what are they for, what are they going to do to my body, how they're going to help me? There's a lot of education that's
But
involved.
Dr. Nusrat, you know what? Last time you came here, you said
Yeah.
something that has stayed with me, and I
Okay.
even mention it to my
Okay.
parents as well sometimes.
Yeah.
You said, you don't go to an eye specialist for a headache, let's say, for
Absolutely.
example, or something
Absolutely.
wrong with your brain as
Absolutely.
well. Because
Absolutely.
when you're talking about diabetes, there are different areas that need to be looked into.
Absolutely.
So you being a diabetologist, while you can do the general, of it,
Mm-hmm.
if God forbid, if a diabetic patient had to get a foot amputation, they would go to you, of course, for the
Yeah.
specialist over here. So
Yes,
there are, of course,
absolutely.
different areas we need to talk about. So, Mr. Kamran, what type of diabetes actually causes or raises the chances of getting, God forbid, an amputation? Is it always necessary that it ends up in amputation, first of all? And then, being the layman, we generally hear that it's because you sort of get numb and you don't feel if you
Yeah.
hit something. That is why, it causes, eventually ends up getting you,
And why is it always the foot?
yeah.
Yeah, good question.
I might have a long-winded answer for
Sure.
this.
Please do it.
But I think I'll make it very clear for all the
Layman.
for a layman. The thing is, when we have diabetes, we have a problem with our blood flow, either because of the osmotic changes in our
Body.
capillaries,
Okay.
or because of the accumulation of plaque in our in our bloodstream, and therefore the blood circulation throughout the body is compromised. So you have macrovascular problems and you have microvascular.
Right.
Macrovascular means you have in the bigger vessels of the body, microvascular in the smaller vessels of the body. Now the macrovascular problems we're talking about blood circulation to the head, to the brain. So you have stroke, or to the heart, where you have heart problems.
Yeah.
And then microvascular, you have 3 places where you have microvascular problems. One is the eyes, so you have retinopathy. Then you have the kidneys, you have nephropathy.
Oh.
And then you have the feet, which is called neuropathy.
All right.
Okay.
All right. So the thing is, why do all of these problems come? Primarily because of compromised blood supply as a result of diabetic problems.
All right.
Okay.
All right. So you can imagine if you have smaller vessels in your eyes, you're going to have eye problem, and if in the kidney, you're going to have a kidney problem. In the feet, you're going to have foot problem. So what happens in the foot is, because of the compromised blood supply, our nerve endings, they start to die,
Okay.
and therefore we do not have any
Blood flow.
any pain sensation.
Oh, right.
Usually we think of pain to be a bad thing, but let me tell you, it's a very positive thing. You
To
know,
have
it
active
tells us we
neurons.
have to do something
It's like
about it.
having parking sensors.
Exactly, absolutely. So the thing is, when you're devoid of that, you're going to have problems. You're going to have ulcers, and you'll not know about them. And then, of course, because of the compromised blood supply, you're not getting the oxygen and the nutrients that are required to,
For
you
that
know,
body part.
heal that ulcer. So I think I've encapsulated
Yeah,
all
That's
this.
great, but how do we help it, you know, for all of those people? Because even one of my uncle, he's got it. So every now and then, you know, what we get to hear is that his foot's not right, and then we actually have to pray for his foot to actually recover as well. And it does at times. And no matter what kind of shoe we get him, every now and then he does get into this trouble. So what is a permanent solution for anybody who's suffering from this disease?
Unfortunately, as far as the foot is concerned, you can only avoid it. Like you can't really get rid of it,
Okay.
but you're going to have to do some preventive measures.
What
And
are those?
Definitely, you need to get tested according to the severity of the disease. You'll have to be stratified which category you belong to, and then for those many corresponding number of visits you'll have to do to a diabetic foot facility.
Yeah.
Which means if you're, you know, not severely ill or you do not have a big problem, maybe once a year, and then it will, you know, gradually go down to once a month or once every 3 months. So it depends upon your risk stratification. So you'll have to come to a facility, you'll have to get yourself checked and stratified, and then accordingly you will be going to the facility and you get yourself checked. The thing is, if you are in a very high risk category, and let's say you have to go to a facility once every month or once every 3 months, and you delay it to a year, of course you're going to have problems.
Obviously.
Right.
Because you'll not be able to pinpoint the problem right when it starts. So
Exactly.
you're going to give it enough time to get exacerbated, and then you're going to have problems. So that's the reason why screening at the right time and consistent follow-up with the specialist, so that you do not come to that stage where you have active
Right.
ulcers.
Okay.
So
Okay.
the prevention will be done by making some special orthotic,
Okay. Or a
according
diabetic
to
shoe or something.
yes, diabetic
Yeah.
shoe is a catchphrase basically, but orthotics is the main thing. The things that you put inside the shoes according to the alignment of your foot and exactly the location of the ulcer that you have.
All right.
So
And it's
you know,
possible to
it's
get
possible
in
to
Pakistan.
prevent it. Yes,
All
Okay.
right.
well,
it's
that's
possible in
wonderful.
2 places in this country, and one of them is the Diabetes Center in Islamabad.
Yeah,
So
and adding on to that, let's just talk about that as well. That God forbid, if it's not being looked into and the person's not been a regular to the clinic, and he goes after 1 year or 2 year, and they say that that particular body part of the thumb is going to catch gangrene. I mean, I think that's what
Yeah,
they
That's what
say.
it's called, yeah.
So then, what is that stage where you actually have to think about letting of your toe go rather than a leg or something else? God forbid.
yes, there's always
And does it often come to that? Sorry.
I think it'll come to once you have the diabetic foot ulcer developed, then it'll be at least 15 to 20% of the cases that will have to be amputated at the end.
All
It's
right.
quite a big number. And as far as the amputations per se are concerned, they are 50% because of diabetes. So
Yeah.
so in the world right now, 50% of all the amputations are because of diabetes.
Oh.
So you can imagine
50% of them.
It is,
That's a huge
yes,
number.
It's
It's
a,
And
it's
it's
a huge
preventable.
number.
This is all preventable.
And it's preventable. But the thing is, we are talking about when, the water has just,
Cross the surface
crossed
as
the
well.
bridge. So the thing is, at that time, we will have to decide on the basis of the severity of the disease whether we have to save the limb now or the life of the patient. And those will be when you really have systemic problem where the patient is going to have other problems and going to be, and those problems are going to be life-threatening. Then of course you'll go for amputation. But our first and foremost priority, as far as a diabetic foot ulcer is concerned, is to save both the patient as well as the
Limb.
foot.
Yeah.
Right.
And that's what we are trained for. And if you come at the right time to a facility, even if you're really in a bad situation, I think you'll be able to.
We'll have to get
Get
to
it
it.
fixed.
Obviously, ladies and gentlemen, I think if it comes down to saving your life or the toe, I know that the choice is going to be difficult. I'm just trying to put myself into those shoes as well. Let's not talk about that, but obviously we'll leave it to the experts. They'll
Right.
assess you, and then yeah, just make sure that you keep on going to the clinic whenever your consultant is actually telling you to, and then you might not have to come across this situation. But very quickly, moving back to Dr. Nuzhat over here, so sir spoke about macrovascular and microvascular problems as well. So can all of these problems lead you to cardiovascular diseases as well?
Absolutely, they can.
They can?
Yeah,
Alright.
diabetes, the minute that you're diagnosed with diabetes, your risk for cardiovascular disease, that's heart disease and stroke, is doubled.
Okay.
So your risk goes up that much.
All right.
Okay.
Okay, then when we talk about preventable risk factors, high blood pressure, smoking, that increases your risk. There's so much that we can do to prevent that risk, and there's so much that we need to make the people aware about.
Okay.
Can I just quickly say,
Sure.
Kamran has been very modest about what he's doing. He's providing a huge service. He's one of the rare healthcare professionals that can not only save your limb from developing an ulcer in the first place, but also after looking after the ulcer, he can make sure that it doesn't happen again
Oh, brilliant.
with the orthotics. Because once you've had an ulcer once, then you are liable, you're at risk to have it again.
Oh,
Because
okay.
your blood vessels are the same, your supply is the same, and your supply to the nutrition, everything is the same.
Okay.
Then it's just down to the orthotics that he makes that will save that toe or save that foot. So he's
Okay.
being very, very modest in what he's saying, but he's doing a huge
But-
amount
Thank
of
you
work
very
on
much.
it.
But that's
Yeah.
brilliant, actually.
Yeah.
That we're so really happy that you're providing such services. But a quick question, and I'm sorry if it's naive as well. Foot ulcers specifically, are they specific to a kind of diabetes, or can they occur to anyone?
First of all, no question is naive.
Thank you.
Absolutely.
Second of all, yes, once you have diabetes, you have to understand your blood circulation is compromised.
Okay.
So it could be any type of diabetes.
Oh, even in children.
Yes, even in
Oh,
children.
unfortunate.
I used to treat somebody who was just 13 years old. She had already had her amputation
Oh God.
back in Europe. But anyway, I had patients who were that young and they had to go through amputations. So the thing is, it's a menace. It's a silent killer.
Yeah,
You know,
it
you
is.
really got to take care of everything. You know,
Yeah,
got to take care of your
and
diet.
I just wanted to add over here. In fact, I wanted to ask both of you, anyone who actually feels like that they can answer the question very well, most welcome. Are there any dysfunctions connected with you getting diabetes of the human body? You know, are there any body organs which might not work just because of diabetes, or any dysfunctions you might get, which you might,
Yeah, that's what it is.
and they might come as a surprise as well?
That's a go for Dr. Nuzhat.
Yeah.
then.
There are, lots of people, because type 2 is a slowly developing disease. What happens if you feel a little bit of mouth dryness, a little bit of tiredness, you might just put it down to eating too much or whatever, and you go through, and your body gets used to those high blood sugar symptoms as well. And we see people going on in their life, and they don't even think that they have diabetes. They would never get checked, ignorance is bliss and all the rest of it. And they carry on, and they suddenly come up with things like sexual problems. We have patients who will come up, male sexual problems, because there's erectile dysfunction.
Alright.
And these is, again, microvascular complication.
Right,
So the
right.
small blood vessels don't work as well. And they're shocked by it. They don't know what's happened, and they will present with that. And certain things like difficulty in vision,
Okay.
that will come up, dawn on them suddenly. If you've never been screened, see, the concept that we don't have in Pakistan is of screening,
Okay.
like checking without any symptom. You don't have to go to a doctor when there's something, especially when you know you're diabetic. You should go for a check. You should screen the back layer of your eye, so that the disease doesn't progress to a stage where there's no return. So yes, that's one of the symptoms as well.
All right.
Exactly, and
Okay, makes
adding to
sense.
that as well, and we want you to be loud and clear to
Yes,
our audiences as well, since we
Yeah.
go out in more than 40 countries, and that is that, so over here people have this normal habit of injecting insulin and eating whatever they want to eat, and they say that it's normal, we can eat whatever because we've injected insulin. Number one.
Yeah.
Number two, is there any herb out there which actually helps you stop, or probably if you had the disease, it's actually going to recover you from that? Because we have a lot of people claiming that these days, even on social media, and mothers come up with these propositions that, hey, what, why don't you go to that person? He's actually going to heal you or make you recover as well. Is there any such thing possible in today's world?
Yeah, you're right. There's a huge market out there that doesn't want to use medicine,
Yeah.
right? And there's a lot of misconception around the use of medication. Can I just clear that a little bit as
Sure.
well? Lots of people will say that medication is what will do your kidneys in.
Yeah.
It's not the medication. It's the raised blood sugar level for so long, X amount of years, that destroys your kidney. It's not the medication you're using that will destroy it. Because what you do is you take medication and you partially treat the blood sugar level.
Okay.
It's not treated to the full capacity. So people will take medication for years and years, the same prescription, but they won't check the blood sugar level and make sure that it's at the target level.
Right.
That will destroy the kidneys. This is why people are generally worried about, because there's a lack of awareness about this. They're worried about taking medication. But then when you're talking about herbs and things, there's nothing out there.
Homeopathic as well.
Yes, homeopathic. There's nothing out there that is going to reverse the diabetes. It's a $1 million question. It's a $1 million market. If it was something, we would know about it.
Yeah.
Absolutely.
But there are certain plants that reduce blood sugar levels on a daily basis. Your Karela, if you use it, and bhindi even, that reduces the blood sugar levels. We know that.
Wow.
There's a Morinaga plant that will reduce it. But imagine how much Karela juice are you going to use? You're going to destroy your insides.
Right.
Yeah.
Isn't it easier to take a pill?
Yeah,
Isn't it easier to
exactly.
take that? Because the blood sugar levels are going to go up on a daily basis. It's not that you're going to take one shot and it will cure you. You have to take it regularly.
That's wonderful.
So it's not worth the trouble. It's not worth the hassle. I wouldn't recommend anyone going down that route.
Thank you very much. Thank you
Thank
very
you
much
for
for
saying
saying
that.
that out loud as well, ladies and gentlemen, straight from the horse's mouth as well. An expert who's actually dedicated an entire life, studied for it as well. So please, I think that it's about time that we realize all of these things as well. And I don't know, I don't think that I should be speaking about it, but imagine homeopathic medicine is always sweet anyways. Would you rather recommend it to somebody who's got diabetes? I don't think so. But sir, very
Right.
quickly towards the end, do you have a message you want to give out to our audiences?
Yeah, I would like to say prevention is better than cure,
Sure.
Absolutely.
of course. So we should direct all our energies towards preventing diabetes rather than treating it. So there are a lot of hospitals, a lot of doctors. This is to all the medical professionals out there. Always go to the public and give them the message that they have to prevent it rather than treat it.
Rather wonderful as well. Thank you very much for being
Thank you
with
very
us
much for
on
having us.
such an important day, which might be tomorrow, but I think we've taken advantage of it.
Yeah.
Thank you very much once
You're most
again
welcome.
for everybody who's out there. Ladies and gentlemen, I think that we really need to go to the expert rather than treating it ourselves as well, and God forbid being in trouble as well. But please do write to us on our Facebook page, which is with the name of,
Well, this morning,
on Twitter,
it's Well This Morning without a G.
on Dailymotion and GTU.
It's with the name of PTV World, and then Well This Morning. Just one small thing, if anyone from an educationist is actually watching, as a kid I really wanted, when I discovered that diabetes can actually be found in kids as well,
Yep.
I really wanted for my school to raise that awareness in probably assemblies, or probably the teachers would say that in the classrooms as well. So first of all, to sensitize us and to let us know that if my fellow was actually having a hard time at that very moment, what would be the first aid that I would do to that? So I think schools should actually take this up as well.
Exactly. So ladies and gentlemen, don't forget to catch the repeat at
5 past midnight.
till the next time. Look after yourselves. 1, 2, 3.
Good morning. Take care.
Stay safe.